Director of Project Bald Eagle, Chief David Young of the Williamsport Bureau of Police, and our County Commissioners Tony Musser and Jack McKernan. The United States is in the grips of the worst heroin epidemic in its history, due in part to a flood of cheap doses of the drug, which can be had for as little as $4 a piece. Heroin is highly available, more than 3 times the number of communities as it was just 7 years ago. Estimates of the number of U.S. heroin addicts range from 300,000 to 500,000, up about 75% from 5 years ago. And while that is just a minor portion of the nearly 24 million Americans that abuse drugs overall, heroin is growing faster than all others. The heroin epidemic is a full-blown health crisis that cuts across geographic, social, racial, and economic boundaries. All told, heroin and related opioid pain pills have killed more than 125,000 Americans in the last 10 years. And federal data indicates that another 75,000 plus pain pill abusers will turn to heroin annually. The challenge in addressing prescription drug abuse and heroin addiction is implementing a comprehensive and coordinated strategy across 5 major areas: education and prevention, treatment, monitoring, proper disposal, and enforcement. Project Bald Eagle has played a very important part in all of that. And it is for that reason that I am pleased to announce today a new law enforcement addiction treatment referral program. This new program has been developed and is being implemented by the Williamsport Bureau of Police, the Lycoming County District Attorney's Office, and Project Bald Eagle. Each year, hundreds of heroin addicts find their way into Lycoming County's criminal justice system after having been arrested by police. Most are arrested for nonviolent misdemeanor offenses. Unfortunately, once they have been arrested, there are often long delays before we are able to get these individuals into the treatment they so desperately need. Heroin addicts arrested on misdemeanor charges will wait several weeks before appearing for a preliminary hearing, several more weeks beyond that for their formal court arraignment, and months before ultimately seeing a probation officer. It is not unusual for there to be a 6-month delay between the time of an individual's arrest until they have seen their probation officer and received their first referral into much-needed treatment. In the interim, most will continue to use heroin without treatment, putting themselves and the community at risk. For our heroin-addicted population, quick referrals and placement into effective treatment options remains a priority not only for our treatment providers, but for law enforcement as well. This new law enforcement addiction treatment referral program would now allow Williamsport Bureau of Police officers to immediately refer, at the time of arrest, individuals to a certified recovery specialist who can then coordinate their immediate referral with our county's treatment providers. I'd like to introduce Steve Schoch, the Executive Director of Project Bald Eagle, who can share some more details about the program.
Just to expand a little bit on Project Bald Eagle, we are a nonprofit organization that is leading coalition efforts to address the opioid epidemic here in Lycoming County. Stemming the tide of what has been labeled the single most largest threat to community health in our county in over 100 years, it's very important that this effort require nothing short of a comprehensive approach. The approach must be comprehensive in 2 ways. First, we need to engage and deploy people from every segment of our society, and you can see the depth and diversity of the communities represented on our board leadership, our mission-specific committees, our volunteers, and our supporters. Secondly, we must be comprehensive in that we hit this epidemic from all angles. Just to hit a few of the key points and to expand on what Eric's presented, we need to educate the community at large as well as our youth about the connection between prescription drug abuse and heroin abuse. We need to safeguard our medicine cabinets to prevent prescription drugs from being diverted into the wrong hands. We need to place an emphasis on training healthcare and dental practitioners to employ a responsible balance of pain management and safe prescribing practices. We need to increase the capacity of the ever-growing numbers of addicts suffering from this disease. And last on this list, improving and simplifying access to treatment. And that is the reason for which the DA has called this press conference today. The collaborative efforts between Project Bald Eagle, District Attorney Eric Linhart, Chief David Young, Captain Jody Miller, who's not here today, and the entire Williamsport Police Department is a great example of what can be accomplished when people come together to discuss problems and identify solutions. The problem in this case, one of which, and Eric outlined some others, but these folks that are addicted to heroin and opioids, it has been stated by the director of DDAP, Secretary of DDAP on a state level, that the average heroin opioid addict is committing 6 crimes each day to support their habit. We know that the threat of legal ramifications is not a deterrent from drug use, and we know that incarceration is not a substitute for treatment. Project Bald Eagle's Recovery Support Committee has been working directly with Captain Jody Miller to design and implement this opioid addiction treatment referral program with law enforcement. Williamsport police officers that now come into contact with persons addicted to heroin or prescription drugs now have another tool to help them in their efforts to protect and serve our communities. Officers have been provided a non-public web form that they can use to make referrals for these addicts. The form submissions prompt a certified recovery specialist to proactively reach out, engage the addict, and attempt to steer them into treatment. This is also known as a warm handoff. Certified recovery specialists have not only completed the required training and passed an exam with the state certification board, they bring an X factor to this epidemic that sets them apart and enhances their effectiveness in steering addicts into treatment. Part of the criteria for becoming a certified recovery specialist is that that candidate had to have been successful in their own recovery to begin with. As of the beginning of this month, only one CRS has existed in Lycoming County. But fortunately, earlier this year, Project Bald Eagle received money from the Pennsylvania Commission of Crime and Delinquency to train additional certified recovery specialists. They completed that training in April, May, and June, and on September 12th of this month, all 11 of those graduates took the state exam and passed. So our county now has 12 certified recovery specialists that can be deployed for these types of purposes. Having these additional certified recovery specialists available makes collaborative efforts such as this referral program with the Williamsport Police Department possible. And our hope is that this program will eventually be replicated in law enforcement agencies throughout the county. Thank you.
Commissioner?
The county's very supportive of District Attorney Linhart and the city getting together and with Project Bald Eagle, and we have to applaud you folks for getting the additional certified recovery specialists done. And we're glad to see that there is an effort to get on the front side of helping people that are addicted, instead of having to wait 6 or 7 months before they get the attention that they need. Thank you.
I'm happy to answer any questions, but I just wanted to make it clear how grateful I am to the Williamsport Bureau of Police for taking a leadership role in this initiative among our county's law enforcement agencies. And the hope is that when it's proves to be successful, and I fully expect that it will, that additional law enforcement agencies in the county will also take advantage of this referral program. Any questions?
You said that there's 12 total. Are they all full-time workers in just this program, or how do they stay available to be able to help?
Sure. So of the 12 right now, 3 are currently employed at agencies. The rest of the folks are currently being shopped around to agencies. We expect that they'll get hired pretty quickly, as agencies that exist in the area are now able to bill for that service, with the service that the certified recovery specialists provide, but they've not had a pool to choose from. So we expect that they'll get picked up pretty quick.
When you say agencies?
Treatment facilities. We have a number of, I don't want to commit anybody in an article, but we have a lot of folks looking at them. People that would benefit from this, you know, from the health system even to treatment agencies. It helps them as well because most of these agencies, most anybody that's in this arena at all understands that the instances where the addict is proactively seeking out the treatment is pretty rare. But if they have that conduit, that person that can connect the addict to the treatment, then the results are far better.
Will there be a lead agency to deploy those?
Well, a couple of things. So, as I mentioned in the statement, Project Bald Eagle has a recovery support committee, and that recovery support committee is going to provide ongoing support and kind of governance for this group, which we've been told in the state of Pennsylvania is not something that's happened before. They're typically on their own once they get their certification. So aside from the support that they'll get from that, that recovery support committee is also working out a way to create a hub so that, in a sense, we're making sure that the person who needs treatment is getting into the right treatment, not necessarily just the one that the certified recovery specialist from that agency happens to be the one who reached out to them. So, yeah. And then certainly we'll be working, the assistant director of West Branch Drug and Alcohol serves on that recovery support committee, so definitely I would think West Branch will definitely play a role in that.
Where did the idea for this come from? Is it something that other areas in the other counties in the state do, or nationally, or is it something that you came
Yeah.
up with? Or?
I mean, do you know of instances with law enforcement?
I know that other counties, and I know this from my experience speaking with other elected district attorneys, that many counties across the state are trying to get creative in finding ways to get the heroin addicted quickly into treatment. And they're doing it in different ways. I'm not personally familiar with another county that has set up a mechanism like we have now here with the city police and Project Bald Eagle that allows officers on the street who've had an encounter with individuals who are heroin addicted to immediately put them in touch with a certified recovery specialist. And so I'm excited about the opportunity to do that, and I think it's going to prove to be very effective.
So that particular aspect is something that the three of you kind of came together and decided that that's what you wanted to do?
Yeah, I think it was Steve's idea, who then reached out to city police and myself to see if there was a way that we could put this together. And I know Captain Jody Miller has been working very closely for a number of months now with Steve to figure out how to best implement it, and has put our city patrol officers through the necessary training so that this program is now up and running.
Two things are certain. I mean, throughout the United States, the average person who's addicted to heroin or prescription drugs is going to encounter law enforcement. The chances that they're going to encounter law enforcement or an emergency department or EMT in the course of a month is pretty high. So they've been identified as two areas that if you can create some kind of mechanism, and there are programs, I think, even in Massachusetts, where people can surrender themselves to the local law enforcement. Not all of those things are practical everywhere, so we really felt with the availability of these certified recovery specialists that the way this program was designed, it would be beneficial to everybody involved.
Do you think it would also change the incarceration of these people at all? I mean, if they're committing crimes and they're being detained or arrested by police, if they get treatment from it, would that help with maybe not getting incarcerated down the
Yeah, so
road?
let's talk about how we think it may or may not impact our prison population. So first of all, when we're talking about the pool of individuals here, we're talking about the heroin addicted who are committing nonviolent misdemeanor offenses. The vast majority of those individuals are not seeing the county prison. They're issued a summons in the mail. They're being told to appear for a preliminary hearing some weeks or months out. And so these are not individuals who, because of the nature of their offense, are often seeing the county prison. That being said, an individual who early on has voluntarily gotten themselves into treatment, who is now clean and doing the right things, is obviously going to be treated differently as their case makes its way through the system than somebody who hasn't. And so that it's even less likely that these individuals will ever see the county prison.
Or be repeat offenders?
Or
Is there a
repeating,
possibility?
sure. You know, and this is true whether we're talking about the heroin addicted or the drug or alcohol addicted. more broadly. All of these individuals, until we get a handle on their addiction, are going to be repeat offenders, right? And so, that's the basis of our drug treatment court program and our DUI court program, which have been around for more than a decade. It's addressing individuals who find themselves in trouble with the law, primarily or solely because of a drug or alcohol addiction problem, who've committed nonviolent offenses. And so the idea is that if we can get these individuals into the treatment that they clearly require, then the criminal justice system won't see them come through the system again. And this is a mechanism and a way where we can effectively get them into treatment months earlier than the system has allowed us to do previously.
Where do the funds come for the program?
Yeah, there's actually very little overhead involved in this. The certified recovery specialists have been trained. Like I say, some of them are already working for agencies, so they'll be working under the payment structure of their organizations, and the other ones as well once they become employed. So there's very little to do. Project Bald Eagle coordinates that mechanism that allows this the form to be sent through, and other than that, we'll do some reporting, provide reporting to the district attorney and to the Waynesboro Police Department. But that's one of the things at Project Bald Eagle I don't know that the community fully understands, is that not only do we lead this coalition, we're trying to hit this from all sides. Project Bald Eagle is a very lean organization. I am the only paid employee. We do not develop programs that we then have to sustain financially over time. We try to create partnerships that are mutually beneficial and therefore require very little overhead. So yeah, there's not much involved by way of that.
Good. Thanks very much.
Thank you so much.